Hi everyone, thanks for coming. Let me introduce myself. My name is Selin Taşçıoğlu, and the topic of today's meeting is hematology or hematology disorders. The meeting is in two parts. At the beginning, we will watch a video about the topic, and then I will present my presentation. Now, I will share my screen.
I'm Frances Bowe. I'm a consultant clinical scientist. When your doctor requests a blood test, it's part of the spectrum of tests the GP might request. Ferritin is a storage compound for iron in the body. You require sufficient ferritin to be able to make hemoglobin, and it carries oxygen around the body. If the patient's got too little ferritin, it shows that their stores of iron in the body are very low. There'll be tiredness. If their hemoglobin has dropped, they may be feeling rather breathless. If you've got too much, it may be deposited in the body and you'll have effects on other organs of the body. When your doctor requests a blood test, first of all, you'll have to go and have your blood sample taken. The blood sample is then sent to the laboratory, and today you'll see what is going to happen to our sample.
My name's Frank, and I'm a medical courier. We bring them to the hospital in a temperature bag.
My name is Vandana. I work at St George's as a biomedical support worker.
Hi, my name is Chelsea. I'm one of the reception supervisors at St George's.
Every sample that we get, we log it. It's just to ensure that we actually receive the sample. It's important so we can track the samples through the system to make sure that we're receiving and get the results. And that's that done. The chemistry sample next, we go in the centrifuge to be spun. Centrifuge is a machine which spins the blood at a very high speed because we want to separate plasma from the blood. Plasma is a fluid in the blood, so zero measurement of ferritin. So we're aiming to measure the ferritin in the plasma. Once it's separated, once I've decapped it, I will load into the machine and then let the BMS know the test that they're waiting for it, which is ferritin. It's all about teamwork, basically, and communication. If you're working in a lab, you would need that mainly. After this, the biomedical scientist will take over from here.
My name's Chris. I'm a biomedical scientist. So this analyzer will take in the samples so that they can be run for any tests that are needed. It can do various tests simultaneously, so they can be sampled at multiple different analyzers. And technology is very important as we run between 8,000 to 9,000 samples every day. So it's very important that we have these, but also our knowledge as well. So we need these to process a lot of samples quickly, but we still need our knowledge in terms of troubleshooting problems and fixing any errors. We also have a very large manual section, so we have a lot of different techniques as opposed to the automated analyzers around here. So a lot of variety. After that time, if it's normal and it's similar to the patient's previous, it will automatically be released. If, however, it's high or low, this result will be flagged up and it will be brought to the attention of one of the biomedical scientists.
Within the department, most of the role of the clinical scientist is to actually look at the results that have been produced on the analyzers by the biomedical scientists. And we comment on the results to say whether they're low, whether the patient has got iron deficiency or low iron stores. And we'll put those comments out to primary care. We don't regard these as results that we would phone out to GPs, but quite frequently we may get phone calls for further information about the test.
I'm Marshall and I'm an advanced biomedical support worker. At this stage, we've taken the sample off the analyzer and I'm going to manually check to make sure all the tests have been completed. No 2 days are the same. Get so many different strange samples and it's just the science behind it, which I find quite interesting.
My name's Daniela Williams and I'm a biomedical support worker for St George's. This is the track and this is where samples go to be filed once they've been tested and completed. The track will begin to take those samples and will scan them by barcode to determine that the tests are finished and where they will go. I like that it's fast-paced. I'm never bored, most certainly. This is where all our samples are stored. They're kept refrigerated as our blood samples must be stored for at least 5 days. What we do is we take it out. For example, take this one over here. These racks are then taken to the cauldron out here. We've got a very large cauldron. So as you see, there's lots of samples stored here, there's at least a few thousand.
My name is Zabihullah Safi, and I'm working as a biomedical support worker. So we have done the test, so we're just keeping it for a week, just in case if the doctor is calling us back, okay, we need a particular test to be added, and then after that, we will take them and check them away.
David Greenwood, Quality Manager and Health and Safety Advisor. The portering team from the Trust collect these bins on a daily basis and take them outside where they're collected and then taken to a company that incinerates them for us. This means that the samples are destroyed in a safe manner, as they are clinical waste, and also any patient identification data, some of the samples themselves, is also destroyed.
So when you eventually go to get your test result back, which will come back very quickly, there are lots of people involved in every single stage of getting the sample properly processed, from the courier who brings the sample to the laboratory, the receptionist who books the sample in, the technical staff who analyse the sample, the clinical scientists who validate it. And then we have a whole background group of people who ensure the results get transmitted correctly through to your GP. You know that you make a difference. It's not every single day, but once in a while you think, I've actually made a massive difference in that person's life because we've been able to a diagnosis really quickly.
Okay, the video is ended. With I want to something about the video. Of course, there are more different and more beautiful videos, but this was bettering shortly for you and me. Okay, and I want to add something the presentation. Finally, we will play a game of Kahoots. Okay, let's move on my presentation. Okay. Again, hematologic disorders, questions, or hematology. At the beginning, definition of hematology. Hematology is the science of study of blood-forming organs and blood diseases. In the medical field, hematology includes blood disorders and malignancies, including types of hemophilia. It's a branch of internal medicine that deals with the physiology, pathology, etiology, diagnosis, treatment, prognosis, and prevention of blood-related disorders. Hematologists focus largely on lymphatic organs and bone marrow and may diagnose blood count irregularities, treat organs that are fed by blood cells, including the lymph. I want to say the role of the hematology special arrange physiological, spiritual, financial, and social support. Okay. Yes, questions. And first question is, a client has a diagnosis of left ventricular failure and a high pulmonary capillary wedge pressure, shortly PCVP. The physician orders dopamine to improve ventricular function. The nurse will now blood pressure decreases, cardiac index falls, PCVP rises. And the answer is B. If dopamine has a positive effect, it will cause vasoconstriction peripherally, but increase renal perfusion, and blood pressure will rise. The cardiac index will also rise, and the PCVP should decrease. Second question, in a severely anemic patient, you expect to find dyspnea and tachycardia, cyanosis and pulmonary edema, cardiomegaly and pulmonary fibrosis, ventricular dysrhythmias, and wheezing? The answer is A. Patients with severe anemia, hemoglobin 6 gram per deciliter exhibit the following cardiovascular and pulmonary manifestations: tachycardia, increased pulse pressure, angine, heart failure, myocardial infarction, tachypnea, orthopnea, dyspnea at rest. The nurse is reviewing the nursing care plan of a client hospitalized with sickle cell crisis, which peripheral tissues, generalized pain duration. Worse list priority. According to Maslow's physiologies are the priority, followed by safety needs and then physiosocial needs. Using Maslow's theory will direct you to option which state inability to deal with the disease, because this is the option that addresses a physiosocial need. Remember to focus on the strategic worst least priority. And the fourth question is, a client is admitted for value. Would the nurse anticipate not being improved by hemodialysis? High hyperthermia, low hemoglobin. The answer dialysis improves or corrects electrolyte imbalances. It has not effect on improving anemia. And fifth question, a client calls a nurse with a complaint of sudden deep throbbing and leg pain. What is the appropriate first action by the nurse? Suggest isometric exercises, maintain the client on bed rest, apply ice to the extremity, ablate for several. Is B. The symptoms suggest deep vein thrombosis. The client must be maintained on bed rest, and the physician. Sixth question. A client with a hemolytic blood disorder presents to primary care center with jaundice. You know jaundice? Okay. The nurse explains to the client that the jaundice is most likely caused by which of the following? Hepatitis infection, loss of plasma proteins, increased bilirubin in plasma, increased C. Lesion of red blood cells causes retention of iron including bilirubin, that is, client has hepatitis. Hepatoglobin binds the hemoglobin. And seventh question is, the nurse is teaching a client about precautions with and the answer is A. Vitamin K is the correct option. Eating foods with excessive amounts of vitamin K contained in green leafy vegetables may alter anticoagulant effects. The eighth question is, the nurse is planning care for a client during the acute phase of sickle cell was an occlusive crisis. Which of the following actions will be most appropriate? Encourage increased caloric intake, ablate in whole day 4 times a day, fluid restriction 1000 cc per day, administer analgesic therapy as ordered. The answer is D. Administer analgesic therapy as ordered is the correct option. The main general objectives in the treatment of a sickle cell crisis is bed rest, hydration, electrolyte replacement, analgesics for pain, blood replacement, and antibiotics to treat any existing infection. And ninth question. The nurse is assessing a client diagnosed with acute myeloid leukemia. Which assessment data support this diagnosis? Nausea and vomiting, excessive energy and high platelet counts, fever and infections, cervical lymph node enlargement, and positive acid fast bacillus. Yeah, the answer is C. Shortly, fever and infection are hallmark symptoms of leukemia. They occur because the bone marrow is unable to produce white blood cells of the number and maturity needed to fight infection. Nausea and vomiting are symptoms related to the treatment of cancer, but not to the diagnosis of leukemia. The clients are frequently fatigued and have low platelet counts. The platelet count is low as a result of the inability of the bone marrow to produce the needed cells. In some forms of leukemia, the bone marrow is not producing cells at all, and in others, the bone marrow is stuck producing tens of thousands of immature cells. Cervical lymph node enlargement is associated with Hodgkin's lymphoma, and positive acid fast bacillus is diagnostic for tuberculosis. The 10th question is, a nurse caring for a client with acute disseminated intravascular coagulation, shortly DIC, should monitor the client for which of the following clinical manifestations? Select all that apply. Dizziness, oliguria, hypertension, bleeding from the nose and mouth, jaundice, sclera, elevated platelet count. Yeah, 6 options. And then the answer is 1 through 4. Again, look. 1, dizziness, 2, oliguria, and 4, bleeding from the nose and mouth. Okay, disseminated intravascular coagulation is a serious bleeding disorder that results in both thrombosis and bleeding. Bleeding occurs due to a very low platelet count. The client will be most likely to have hypotension rather than hypertension. Jaundice sclera indicates hemolysis or liver disease. 11th question. A 34-year-old client with sickle cell crisis is talking off the telephone but stops as the nurse enters the room to request something for pain. The nurse should administer the prescribed analgesia, encourage increased fluid intake, recommends relaxation exercises for pain control, administer a placebo. And the answer is A. Administer the prescribed analgesia. Relief of pain is the expected outcome for treatment of sickle cell crisis. Pain may be present even without overt signs. And then the 12th question. Which signs or symptoms should the nurse expect to assist in the client diagnosed with hemophilia A? Epistaxis, intermittent claudication, subcutaneous emphysema, petechia. Okay, the answer is A. Nosebleeds along with hematrosis, cutaneous hematoma formation, bleeding gums, hematemesis, acute blood, and hematuria are all signs or symptoms of hemophilia. Petechia are tiny purple or red spots that appear on the skin as a result of minute hemorrhages within the dermal or submucosal layers, but they are not signs of hemophilia. Subcutaneous emphysema is air under the skin, which may occur with chest tube or tracheostomy insertion. Intermittent claudication is severe leg pain that occurs from decreased oxygenation to the leg muscles. If the test taker knows that hemophilia is a bleeding disorder, the test taker should eliminate any answer options that don't address bleeding. And then 13th question. The nurse is caring for a client with a deep vein thrombosis. Which of the following symptoms would require the nurse's immediate attention? Pulse rate of 98 beats per minute, temperature of 102 degrees Fahrenheit, respiratory rate of 32, blood pressure of 90 per 50. And then the answer is C. Respiratory rate of 32 deserve an urgent attention. Clients with deep vein thrombosis are at risk for the development of pulmonary embolism. The most common symptoms are tachypnea, dyspnea, and chest pain. Yeah, you can see some picture, chest pain. And the 14th question. The nurse is assessing a client's activity intolerance by having the client walk in a treadmill for 5 minutes. Which of the following indicates an abnormal response? Pulse rate increased by 20 BPM immediately after the activity. Respiratory rate decreased by 5 breaths per minute. Diastolic blood pressure increased by 7 millimeters Hg. Pulse rate within 6 BPM of resting pace after 3 minutes of rest. The answer is B. Okay, the answer is longer than the answers. But B, the normal physiologic response to activity is an increased metabolic rate over the resting basal rate. The decrease in respiratory rate indicates that the client is not strong enough to complete the mechanical cycle of respiration needed for gas exchange. The respiratory system works in conjunction with the cardiovascular system. The pulmonary circuit receives almost all of the cardiac output. In response to the increased cardiac output, perfusion increases in the apex of each lung, increasing the available surface area for gas exchange. Decrease alveolar deep space. And 15th question and last question. A nurse is assessing the neurovascular of a client who has returned to the surgical nursing unit 4 hours ago after undergoing an arterial bypass graft. The affected leg is warm and the nurse notes redness and edema. The pedal pulse is palpable and unchanged from admission. The nurse interprets that the neurovascular status is normal because of increased blood flow through the leg, slightly deteriorating and should be monitored for another hour, moderately impaired and the surgeon should be called, adequate from an arterial approach, but venous complications are arising. The answer is A, normal because of increased blood flow through the leg. An expected outcome of surgery is warmth, redness, and edema in the surgical extremity because of increased blood flow. Aortoiliac occlusive disease can contribute to lower extremity ischemic symptoms necessitating intervention. Symptoms of patients with aortoiliac occlusive disease may include claudication, respair of the lower extremities, or ischemic ulcer formation on lower extremities due to inadequate blood flow. Okay, thank you for your attention. Thank you for listening. And my presentation is ended. Okay, and now let's move on to play for game. Okay, can you see the Kahoot screen, Deniz?
Yes.
Okay. Okay. The code is coming fastly. Okay, 4%. Five. Okay, 5 is enough. Yes, hematologic disorders questions. Yeah. The nurse will instruct the client to eat which of the following foods to obtain the best supply of vitamin B12. Okay, my screens I can see. Okay, good. Transfers meat and dairy products. Okay. Second question. Which of the following cells is the precursor to the red blood cell? Shortly, RBC. Okay, good results. Which of the following symptom is expected with hemoglobin of 10 gram per deciliter? Okay. The first question. Sorry. Which of the following diagnostic findings are most likely for a client with aplastic anemia? Okay, the answer is increased levels of white blood cells, red blood cells, and platelets. Okay, fifth question is, which of the following disorders results from a deficiency of factor VIII? You know, hemophilia A, hemophilia B, Christmas disease. Yeah, okay, good job. Hemophilia A, cancer. Okay. And which of the following blood components is decreased in anemia? Yeah, answer is red option. The other question is, in a severely anemic patient, you expect to find cyanosis and pulmonary edema, ventricular dysrhythmias and wheezing, cardiomegaly and pulmonary fibrosis, and dyspnea and tachycardia. Okay. And eighth question. The primary pathophysiology underlying thalassemia is? Okay. Yeah. You encourage the patient with cobalamin deficiency to seek treatment because untreated pernicious anemia may result in liver failure, gastrectomy, heart failure, and then death. Okay, the true answer is red option. Okay, no problem. And last question. Yeah, thanks. You correctly identify which descriptions as characteristic of anemia of chronic disease. Select all that apply, one or two options. Yeah, the true answer is red option. Okay. Yeah, the result is coming. Zeynep, congratulations. Melis, congratulations. Okay, and Fazilet, congratulations. Also, Barış and Deniz, congratulations too. Okay.
Thank you.
And then the game is ended. Deniz, I can't hear that.
Thank you for your sharing.
Okay. My presentation is ended, you can see. I think it was good for me and for you, I hope. Thanks for coming again, and thanks for attention, listening. Okay, you know. Have a nice day and see you soon.